North Shore Medical Center, based in Salem, Massachusetts, a member of Partners Healthcare System, is among the top 5 busiest emergency departments in the state, with more than 90,000 visits each year. As part of the hospital's Culture of Excellence initiative, the medical center has made a perfect emergency care experience priority 1. Providing consistently safe, high-quality emergency care is an ongoing challenge in a Level 3 trauma center. NSMC recognized that better efficiency in the ED would help reduce backups throughout the hospital and enhance professional satisfaction among caregivers. So it formed a team to redesign how the hospital provides emergency care.
To not just go after reducing wait times, but peel apart the process of care delivery in the emergency department and think through how we could deliver a better experience for patients.
Below the emergency department, in a windowless room known as the War Room, the emergency department transformation team meets 3 full days each week to analyze the systems they use and the methods by which they triage and treat patients. When they're not working around this table, reviewing data and discussing patient experiences, they are upstairs in the ED, testing new care models as a team.
We always want to make it better. We always want to make that patient experience better. We always want to know that at the end of the day, when we walk out that door, that we did the best job that we could.
Emergency department nurse Susan Douglas and Dr. Stephen Browell are 2 of the 6-member team that has lived, breathed, and slept emergency department transformation for the past year, along with a unit secretary, registration representative, nursing technician, and physician's assistant. This group has taken giant steps forward in changing the culture and practice of emergency medicine. On this wall outside the War Room, the team has documented every aspect of care from the perspective of patients and caregivers.
So over here we have a depiction of how our computerized medical record is generated. So this is trying to define and understand what the status quo is, and what we've learned from this is that the nursing and the caregivers are spending a tremendous amount of time trying to input information into our computerized medical records.
The program, which is officially known as iCare for Integrated Care and Rapid Evaluation, is still in its pilot stage, but already patients are feeling the benefits of a new team-based approach.
It's amazing how nice and friendly the people are, how smoothly it ran. They saw me, they moved me right through.
20 minutes I was in here being cared for, so it's pretty awesome today.
It's been tremendously gratifying, both in terms of the early results that they and we are seeing, but maybe more importantly in terms of the, let's say, the growth in the culture of that team believing that their opinions and their work really makes a difference. And that's the part that I've been most impressed with as they've gone through their journey.
I think that the single biggest success has been creating a system where we're able to both simultaneously improve patient satisfaction and the patient experience while simultaneously improving the caregiver experience.
I love my iCare days. I have a better day at work when I work in the iCare model because I have the physician right there with me. I know where all my nurses are. I know that all my patients are right in front of me.
One of the keys to iCare's success is keeping these teams together for their entire shift. Caregivers are concentrated in space and time around the patient. The focus is our patients, not my patients. Communication is improved, and even supplies are within each team's reach to maintain efficiency. The effort is supported by a special IT program designed to track the work.
This has been a really revolutionary way of making change for any hospital department, but particularly for an ED. It's made a big difference, so the satisfaction has gone up. There's a lot more learning, a lot more understanding, and a lot more communication about the patient.
Already, the iCare pilot has cut the length of stay in the emergency department from 3 hours 20 minutes to just 2 hours 40 minutes for moderate acuity patients. To date, most of the iCare pilot has been conducted here in the emergency department's fast track zone, a 7-bed unit designed for minor cases. Its small, confined space has been ideal for launching the program, but NSMC has begun testing iCare successfully within the full emergency department as well.
So starting in that geography was a great way to get them to test some of the concepts of team care that they came up with. But it's obvious to them and to all of us that eventually this concept has to be spread and be able to work in the larger geography of the emergency department, and it has to work in the somewhat chaotic environment of an emergency department.
The way the model was designed, we know it works. So the goal of what we're trying to do with this team is to take the traditional patient model of caring for the patient in the emergency department and break it down and try to improve it.
North Shore Medical Center is taking a leadership role in responding to the national imperative to deliver safer, higher quality, and more cost-effective care. The integrated care and rapid evaluation model proves that by setting a clear objective, committing staff and time to the process, doing the analysis, throwing out preconceived solutions, and testing the models, emergency medicine can be transformed.
We actually didn't know what kind of impact we'd be able to have, but we knew it was important to improve the patient experience. They've come to us looking for care. We have an obligation to provide perfect care for them at that point in time, and that's what we're going to do as we treat these patients.
To have somebody who comes in with a relatively simple complaint that should only take 15 or 20 minutes to address, and to be able to do it in that amount of time and see them leave with a smile on their face and a sincere thank you is tremendously fulfilling.
For more information about North Shore Medical Center and the Eye Care Initiative, visit nsmc.partners.org.